Shay. Thank you. I'm Professor Smoot, and I can talk to you some about the impact of artificial intelligence that is going to be felt at an increasing rate in the world today. Last year, about 20% of the work that was done in the world was done by AI, and the other 80% was done by humans. In 2 years, in 2022, it will be 40% by AI and 60% by humans. Now, what that means is you think people doing repetitive jobs are going to be replaced by AI. And that's the kind of general wisdom. But that's why I'm going to talk to you about AI replacing medical doctors. This AI, being described by this person on the stage, just beat human doctors in a clinical trial. This was back at the end of June of last year, and it was presented at the London College. And this AI system had been designed to do clinical examinations of patients. So a patient comes in, asks questions, does tests, and then makes prognosis, what the treatment should be, and so forth. And this system was able to get a score that was 72% higher than the average doctors. And you can say, well, how's that possible? Well, imagine you're building an AI system. You put all the medical textbooks in it, so it went to medical school and remembered every course perfectly. And then you give it 5 years of clinical experience, and that's where you start with. That's the basic idea. And the AI system runs simulations as to what the particular symptoms might be and what it might be able to figure out. And then by doing these simulations and comparisons and asking more questions, it's able to do a very good job at estimating what the possible diseases are and what treatment should go. Now, the issue here is this does not work by itself right now. The AI makes the best estimate it can, and it's better than the average doctor with 5 years of clinical experience. But when you combine this with a doctor, you end up with a 99.5% efficiency. That is, it's not getting, like an average doctor, 70 or 80%, and the AI getting 80 or 90%. The combination is getting very high. So right now, it's the combination of doctors and AI. The time will come when the AI is able to be nearly 99 efficient. So it is clear that AI is coming to play a really major role in medicine. Zhaoyi recently became China's first qualified AI medical examiner. These are actually mostly chatbots. That is, they ask questions, they gather data and put them together. Here it's put in a compute body so that the medical people and the patients will respond to it well. And in doing so, in September, it was given the license to practice medicine in China. That is, as it was given medicine, it was practiced, and it was actually allowed to practice some medicine, its score started improving. That it learned from what it was doing, right? But there's still a long way to go before it's ready to practice independently, but a long way is a relative term. The thing about humans is we're used to seeing things happen, improving linearly with time. The AI is going to be improving exponentially with time. So it's coming faster than we would normally extrapolate. Think about how you get a doctor now. You send them to medical school. They go through undergraduate and then medical school. Then they get 5 years of practice. And then you have a doctor who's certified to practice medicine. Here, you can build a whole array of Zhaoyi. You can produce them on a time scale of 3 months. They can all be learning from practicing and past not just their personal experience, they can pass their experience back and forth perfectly well. So AI is going to change your healthcare, and it says it won't replace your doctor. It will slowly replace your doctor. That is, it's going to be a combination of things like Zhaoyi and the doctor working together that are going to be going on. And doctors are already being assisted by AI. That is, almost all imaging now is, you will see for the high resolution image, is done by AI systems, because in order to get 3D high imaging, you have to line things up very precisely and scan and take it and fit it all together. But then there's so much data, a doctor would take a very long time to look through it. Now the AI system can scan through very quickly, and then the doctor can go to the computer and zoom in and out in 3 dimensions and look at each of the areas that the AI has told the doctor to be looking to see if there's something interesting there. And there's a whole series of places where we're seeing breakthroughs. So this is a field that's extremely active right now, and the progress is being very rapid, partly because we did not have the tools to do the neural net learning that were easy, and we didn't have the databases and outcomes that we could feed into those to make it work. Now all those things come together in medical care from the neural net learning from a database and outcomes. So Google AI was running, and it was doing some medical or health-related stuff to see what you could do about eye diagnostics. And what they saw with their high-quality images of eye was that you could also predict heart problems as a result of seeing what was happening to the blood vessels in the blood flow in the eye. And so it's quite clear that having better sensors and having a bigger data set and having AI combined with that allows you to start making associations and start doing medical treatments much better than we were able to do in the past. So the future of radiology and artificial intelligence are already tightly combined, but it's going to get more so in the future. So I had a picture on the side of the first hand X-ray, which was high resolution on an X-ray film, and that was 100 years ago, but the resolution was only as good as film was in those days, and now we're making images of the body in 3D from X-ray scans, from magnetic resonance imaging, from a number of ways, from sound, and we're able to make them with more and more precision. In order to make that precision, you have to line everything up very carefully. You have to do the scans and repeat because you're making slices and you're putting them all together into a 3D image. And then if you double the resolution of an image, you make 8 times as much data. So now we're doing factors of 10. We have 1,000 times as much data as doctors used to be processing. So it's AI is processing ahead of time and then providing that with some estimates and some suggestions to the radiologists about what they're seeing in the images. So another example of this that's relatively new is face scanning AI identities. So in China, you're very aware of the face scanning and the recognition, face recognition, but it turns out you can use the face scanning and use that to search for rare genetic disorders. And so there's an example of a picture of this young woman, and it's scanned, and a lot of the same algorithms that are used to recognize a person are now then used for deep learning to look for genetic disorders and see what it can recognize. So this young girl from Israel was scanned. They went through the decomposition and the refitting back together and projected what diseases she might have with what probability, right? And they're all rare diseases. However, if you can get doctors and medical facilities to send in the data, the pictures from the people with rare diseases, then you have a big database. You've got the situation where now you have a large number of images and a large number of outcomes, and you can associate these images with the diseases so that you scanned another person, you can see that. And this is a algorithm that's going to be made available around the world. As long as people will put more data in the database, it will become more useful around to everyone around the world. Okay, and here's another example of a rare disease. So this program is designed to look for particular rare diseases, and the program's accuracy has improved slightly because people have been uploading patients with these rare diseases, right? But they're up to 150,000 images in the database, and the thing that they realized is that, for example, the children from the Belgian Congo did not get diagnosed nearly as well as the people from Europe and the United States, where there were a large database, and that was because there was insufficient database, and the racial type is somewhat different, so the programming doesn't match. So it becomes a worldwide effort that you want to be putting these things in, but this is something where the typical doctor is going to see 1 or 2 of these in their whole career. But if you bring all these data together, then the AI will have seen hundreds of thousands of cases like this. So here's another example. So this is, again, another set of software that's now available freely around the world. And it's AI has been shown that it outperforms expert doctors at finding cervical precancers. So why is this relevant? Well, these algorithms, it's very important. If you can catch the pre-cervical cancer, the precancerous lesions, you can treat it much more quickly and so forth. So why is this relevant? Well, it's the 4th most important cancer in women, and there was estimated last year more than 570,000 cases, and the global death rate was about 266,000. Okay, that's very high, but most of that global death rate was from less well-off countries, the middle, low and middle-income countries, and the reason for that is they don't have the doctors with experience to look for it, or even think to look for pre-cervical cancers. But the fact is, by detecting it earlier, you can treat it earlier. You can take care of it. So again, this is a thing where it's shared and worldwide brings a big improvement. So here's another example. This is a very severe tumor in the head. This guy is showing how the AI lets you scan in and out.
Eyes here and the nose. So I can scroll up and down here in the vertical direction. You can see different structures of the brain. And the same here, I can go from one side to the other.
Now, this is pretty simple to see in the image. They picked a really severe case. But the computer allows you to scan very carefully and compute the size very carefully, figure out the treatment. But even more than that, there are several different types of tissues in there, and they require different treatments. So if you catch them much smaller and you can distinguish between the various pieces, you can treat it much more quickly. So this is a combination of AI. He's saying here the computer helped him get the size, help him do the calculations. It's something that would take him many hours, got it done in a much shorter time. And here's examples of artificial intelligence aiding detections in chest radiography. So there are diseases that happen mostly now in low income and developing, barely developing nations. And there are tuberculosis, there are other things like that. So chest X-rays allow you to diagnose a lot of things like that early and to think about how to do the treatment. The resolution is much higher. The artificial intelligence scans through, outlines the area, makes suggestions on what the possibilities are, and tells the doctor to look carefully and what you might think about doing in this case. So again, it's a shared human AI labor, right? When I say in 2 years it'll be 40% to 60%, that's the sort of level that we should be looking at in 2 years for doctors. So there are a lot of clinical applications of AI and medical diagnostics these days. There's, the chatbots who are doing the diagnosis, like the examples I gave you at the beginning. It's for oncology, pathology, and the rare diseases. Those are the applications in which AI has already proved that it's going to be a big factor and is growing rapidly. So one of the other things is you can do training algorithms that can look at speech recognitions and image recognitions to diagnose tumors. That is, there are more things that tell you information about the health and the well-being of a patient or the medical conditions of the patient than just probing is it sore here? That you can tell by how people are talking, how they're behaving in a lot of ways. So in the future, doctors and patients are going to be connected and patients continually monitored. And that's because people are going to live much longer. They're going to have some long-term medical conditions or health conditions, and they're going to want to monitor and manage that. And you cannot afford a doctor for every person, but you can afford an AI to be monitoring the many sensors on that human and then figuring out what's going on and notifying the doctor periodically. So the doctor and the patient are continually being connected, but the AI is going to be doing the burden of actually full-time monitoring of the person and sending data back to the person so they can see how they're managing their health. You know, what changes are coming? Well, the changes have been coming already, and we all have monitoring systems and other things that let us monitor what's going on. The first thing that the AI and the sensor is going to do is help the patient understand the drivers that impact their chronic conditions so they can play the interactive role and the proactive role in taking care of their own health. The data will be streamed, and then that data can be used to monitor the patient, but it can also go into a general pool where you can see the data from many, hundreds of thousands to millions of people and see what the progress is and what's going on and how to handle those things better. So someday I think we will see everyone having sensors on themselves from birth to death and also be getting feedback on how their behavior is affecting their health and how their choices are affecting their health. And there's another thing that's happening, and it's already come to Japan, it's already come to a lot of places in Europe. It will be coming in 10 years to China, or a little less, that there are going to be a lot of older people. And you have a choice about, do you have people taking care of them, or do you have robots taking care of them, or what do you do? And in Japan, they've made the choice to use robots. In some places, they've made the choice to bring in immigrants. In China, there's not enough immigrants to bring in to take care of everybody. So it's going to be a combination of things. But there are already robots for companionship, robots for making sure you're eating properly, exercising properly, taking your medicines and so forth. And there will be robots for taking care of people who physically can't get in and out of bed or do other things that need some support. And that's going to be going on. And that's just absolutely necessary for the fact that we have an aging population in the world. And I believe in the future we're going to have nanomedicines and everything. And in the future where infectious disease is a thing of the past, in that future, we're going to have 3 out of 4 people be able to beat cancer, right? Then I'm still talking in relevant near-term future, that we're going to know how to detect cancers early or have vaccines against cancers and so forth. So people are going to live even longer, and therefore they're going to have to be monitoring their health and taking care of themselves better. And there are new sensors and new IT and new AI levels are going to be key to managing that. And that's how I got into this. I started doing new kinds of sensors and so forth. A human embryo is going to be edited to take out disease. Now, we already had what appears to be an example of that within the last year. There was a lot of pushback against it because it didn't go through careful checks and balances to make sure that when you introduced into the human genes stream new edited things, that it wasn't going to have other consequences long term. And there are people calling for a 3-year moratorium until things worked out. But the fact is, we have the technology and the capability now of editing human embryos or the germ cells, and we're going to be able to do it so we can edit people about disease. So, in the meantime, surgeons could be practicing complicated procedures on models that are created by 3D printers, both for training, for learning, for practicing, for many things. There's a future ahead that's very interesting. It's only a question of how people decide to do it and how quickly they will do it. And remote patient monitoring then becomes sensible when you can just go and send the drone and get a sample back. And you have devices and sensors on them. They don't have to go to the hospital. You can monitor them equally well remotely as you can from in the hospital. And so that's going to become very standardized. There's already a hospital that's nearly 1,000-bed hospital in the United States that has no beds. It just has remote monitoring of the patients in their own homes. And AI is providing some of the continuous monitoring, and then there are people who come on shift and are available. Okay, so in this, information technology and artificial intelligence are big drivers, and you will see that. the growth of healthcare data, that is, data about yourself and data about everybody else, is increasing at nearly 50% annually. So in 2013, there were 153 exabytes of data about health. We expect by next year there'll be 2,000 exabytes of data. If you don't know what exabyte is, it's exabytes and terabytes and gigabytes. It's a huge amount of data. And we couldn't have thought about dealing with that before until we had AI systems and big complex IT systems that can be looking for these relationships and looking for in this multidimensional space for the connections between diseases and people and so forth. So I have in the upper right-hand corner this baby. It's got a sensor on him, but he's also looking at a screen that's monitoring him. You know, people are going to have data from, you know, the time they were an embryo, especially starting from the time they were born and going on and on. If I had my own way, everybody would get a stem blood cell from the umbilical cord frozen and saved for the genetic treatment they're going to need in the future to fix whatever problem that got developed. But that's where we're going to be. And it's very clear AI is going to have a big impact on medical and healthcare. It's this funny thing. It's a threat, but it's also tremendously going to improve your health and well-being. So, xie xie.